I call the member for Buderim.
Deputy Speaker, today I will raise the effects of a toxic culture running through the wards of Queensland's newest and shiniest hospital, the Sunshine Coast University Hospital. And I'll detail how bullying complaints and serious allegations were ignored by the hospital board, by Queensland Health and by the government. Under this government, it was a culture that was rampant for almost 3 years. The Sunshine Coast Hospital and Health Services performance has gone from bad to worse, and it all started with mates helping mates while experienced staff walked out the door. No integrity, a culture of cover-ups and looking the other way. Here are the facts, Deputy Speaker. In April last year, I submitted an RTI application about the behaviour of senior employees in the Sunshine Coast Hospital and Health Service after being approached by multiple staff who told me of a dysfunctional workplace characterised by bullying, harassment and intimidation. They told me of their fear of reprisal by senior management and of a hospital system where patient care was suffering because of mismanagement at the highest levels. My RTI request was a simple one if the health service had nothing to hide. 6 weeks later, after the RTI request was submitted, the then CEO, Naomi Dwyer, resigned. Hardly a coincidence. Here we are, February 2022, 10 months since the request was made, and after fighting tooth and nail to get the information that I requested nearly a year ago, I finally have the results of that RTI. One document, a letter written to Dr John Wakefield, the Director-General of Queensland Health, stated it was, and I quote, a desperate plea for his direct intervention and help. It says the leadership of the Sunshine Coast Hospital and Health Service is in crisis due to the appalling behaviour and conduct of the Chief Executive, Naomi Dwyer, and her Chief Operating Officer. The work environment was described as harsh, punishing, unreasonable, chaotic and increasingly dysfunctional. And it states that this, without a doubt, is impacting the health services performance and its people. The letter states that there were serious failings of duty of care, and no action was taken by the hospital board or Queensland Health, despite them being aware of the issues. It says that there was a pervasive, brutal culture of blame, fear and retribution. People were too afraid to make a complaint because if the CEO or Chief Operating Officer found out, their careers would be over. The threat was that real. The person ends this damning letter with an appeal to the head of Queensland Health for CEO Naomi Dwyer and her Chief Operating Officer to have their contracts terminated immediately. They weren't. We know this didn't happen, and in fact Ms Dwyer resigned only after my RTI was submitted, and she was given very public accolades on her way out. Here's what else we know, Deputy Speaker. All 7 of Ms Dwyer's executive-level direct reports left the health service within the first 12 months of her being appointed as the CEO. At least 24 senior staff members left the health service while Ms Dwyer was in charge. There is no way this went unnoticed. During Ms Dwyer's 3-year reign, there were 5 different heads of people and culture on the Sunshine Coast. 5 different heads in 3 years. Despite the rhetoric we heard this morning from the Attorney-General, last year 2 brave whistleblowers had their employment suspended. The CEO and the Chief Operating Officer may have now left, Deputy Speaker, but the effects from the toxic culture they created are still being felt. 30% of all elective surgery patients on the Sunshine Coast are not treated in time at the Sunshine Coast University Hospital. In fact, the Sunshine Coast University Hospital has the 2 worst performing hospitals in all of Queensland. As the letter states, the work environment was without a doubt impacting the health services performance and its people. If only the hospital board and Queensland Health had acted when they were first made aware of the bullying and intimidation, or when executives and high-level medical staff started dropping like flies. The health service is still struggling to attract experienced doctors because its reputation has been destroyed. And that is why people like Wendy Carter in my electorate of Buderim, who was down here last year, has been waiting months, wheelchair-bound in severe pain, just to get an appointment she should have within 30 days. It's why 2 12-year-old girls in my electorate have languished for months longer than they should have, waiting for surgery on their knees. Deputy Speaker, it is clear that the culture of cover-up, so pervasive within this Labor state government, has resulted in Queensland health workers being bullied, harassed and victimised. They and the Sunshine Coast residents that they care for deserve better. The toxic culture and failures of leadership that were allowed to fester in the Sunshine Coast Hospital and Health Service for almost 3 years need to be exposed. The Board, Queensland Health leadership and the Minister for Health have all failed in their duty of care to Sunshine Coast health workers. This appalling behaviour and the cover-up that followed must be exposed to ensure that it doesn't happen again. Not on the Sunshine Coast, not on anywhere in Queensland. There must be accountability, and I call on the Minister for Health to explain why neither she nor her predecessor, the Deputy Premier, didn't protect health workers when they should have.
I